Hello everyone, I'm Herman Walker. I'm taking nursing 444, which is a community health nursing at Indiana State University. Today we're going to talk about diabetic risk factor and prevention education. The learning objective, the participant will be able to describe or define diabetes mellitus. Participant will be able to know the origin and the cause of diabetes mellitus. Participant will be able to describe the different type of diabetes mellitus. Participant will be able to describe the different signs and symptoms of diabetes mellitus, and participant will be able to know how to manage and to prevent diabetes mellitus. Please, before we start the education, take a few minutes and just follow the link, copy the link below and take our pre-test quiz. What is diabetes mellitus? Diabetes mellitus, most of the time called diabetes, is a chronic multi-system disease characterized by hyperglycemia from abnormal insulin production, impaired insulin use, or both. 29.1 million of people, or 9.3% of the United population, have diabetes mellitus. 86 million more people have pre-diabetes. About 8.1 million people with diabetes are unaware or have not been diagnosed with diabetes. Diabetes is the seventh leading cause of death in the United States. Adults with diabetes have heart diseases, death rate, and risks for stroke that are 2 to 4 times higher than non-diabetic patients. Etiology and pathophysiology. Current theory link the cause of diabetes singly or in combination to genetic, autoimmune, and environmental factors such as viruses and obesity. Diabetes is primarily a disorder of glucose metabolism related to the absent insulin supply and or poor use of available insulin. Here on this image, you can see how insulin bind to receptor. Different type of diabetes and risk factor. The most common type of diabetes are diabetes type 1 and diabetes type 2. Diabetes type 1 is formerly known as juvenile onset diabetes or insulin-dependent diabetes mellitus. It accounts for 5 to 10% of the people with diabetes, affect people less than 40 years old. Type 1 is an autoimmune disorder in which the body develops antibody against insulin and all the pancreatic beta cells that make insulin. Type 1 diabetes requires insulin from outside source. Without insulin, patients can develop diabetic ketoacidosis, a life-threatening resulting in metabolic acidosis. Family history: having a parent, brother, or sister with type 1 diabetes. Age: you can get type 1 diabetes at any age, but it is more likely to develop when you are a child, teen, or young adult. Type 2 diabetes, formerly known as adult onset diabetes or non-insulin dependent diabetes mellitus. The risk factor for the population, it accounts for 90 to 95% of people with diabetes, have pre-diabetes, are overweight, are 45 years or older, have a parent, brother, or sister with type 2 diabetes, are physically active less than 3 times a week, have ever had gestational diabetes during pregnancy, or given birth to a baby who weighed more than 9 pounds. The more affected are African American, Hispanic, Latino American, American Indian, or Alaskan Native. Let's common type of diabetes mellitus. We have pre-diabetes, gestational diabetic, and other specific type of diabetes. Pre-diabetes is defined as impaired glucose tolerance, impaired fasting glucose, or both. It's an intermediate stage between normal glucose homeostasis and diabetes. Person pre-diabetic is increased risk to type 2 diabetes. The risk factor are: you have overweight, 45 years or older, having a parent, brother, or sister with type 2 diabetes, physical active less than 3 times a week, having ever had a gestational diabetes, And for gestational diabetes, it's occurring during pregnancy in about 2 to 10% of pregnant women. And the risk factor are you have to be having gestational diabetes during a previous pregnancy, have given birth to a baby who weighs more than 9 pounds, overweight, more than 25 years old, having a family history of type 2 diabetes, and have a hormone disease they call polycystic ovarian syndrome. And the other specific type of diabetes mellitus is one of the less common. It occurs in some people because of another medical condition or treatment of a medical condition causing abnormal glucose level. This includes Cushing syndrome, hyperthyroidism, recurrent pancreatitis, cystic fibrosis, hemochromatosis, and parental nutrition. Here on this slide, we have some signs and symptoms of diabetes mellitus. If you have any of the following diabetes symptoms, see your doctor about getting your blood sugar tested. You have urinate, pee a lot, often at night, or we usually call it polyuria. You are very thirsty, polydipsia. You have lost weight without trying, are very hungry, have blurry vision, have numb or tingling hand or feet, feel very tired, have very dry skin, have sore that heal slowly, or have more infection than usual. Other symptoms, type 1 patient may have an addition above nausea, vomiting, or stomach pain. Type 1 diabetes symptoms can develop in just a few weeks or months and can be severe. Type 1 diabetes usually starts when you are a child, teen, or young adult, but can happen at any age. Type 2 often takes several years to develop. Some people don't notice any symptom at all. Type 2 usually start when you are an adult. 12 more and more children and teens are developing it. Because symptoms are hard to spot, it is important to know the risk factor for type 2 diabetes. Make sure to visit your doctor if you have any of them. Gestational diabetes usually doesn't have any symptom. If you are pregnant, your doctor should test you for gestational diabetes between 24 and 38 weeks of pregnancy. If needed, you can make change to protect your health and your baby health. Prevention of diabetes mellitus. Diabetes type 2 and pre-diabetes. You can prevent or delay type 2 diabetes with simple proven lifestyle change such as losing weight if you are overweight, eating healthier, getting regular physical activity. Diabetes mellitus type 1, currently no one know how to prevent type 1 diabetes. Gestational diabetes, before you get pregnant, you may be able to prevent gestational diabetes by losing weight if you are overweight, eating healthier, and getting regular physical. Diagnosis assessment. For diagnosis assessment for diabetes mellitus, we have A1C test. The A1C test measures your average blood sugar level over the past 2 or 3 months. An A1C below 5.7% is normal. Between 5.7 and 6.4% indicate you have pre-diabetes, and 6.5% higher indicate you have diabetes. We have fasting blood sugar test. They measure your blood sugar after overnight fast, no eating. A fasting blood sugar level of 99 milligram per deciliter or lower is normal, 100 to 125 milligram per deciliter indicate you have pre-diabetes, and 126 milligram and above indicate that you are diabetic. We have glucose tolerance test. Yeah, this one measure your blood sugar before and after you drink a liquid that contains glucose. And you have the test is gonna be checked 1 hour, 2 hours, and possibly 3 hours afterward. At 2 hours, the blood sugar level of 140 milligram per deciliter or lower is considered normal. 140 to 199 milligram per deciliter indicate you have pre-diabetes, and 200 milligram deciliter or higher indicate you have diabetes. We have a random blood sugar test. A random blood sugar test, you don't need to fast. You can take it whenever you want, home or work, on your break, whatever you want. And here on this table, you can see the result of if the table shows the result of A1C, fasting blood sugar test, glucose tolerance test, and random blood sugar test. This image is here kind of give you some diabetes, pre-diabetes, and normal diabetes, normal value of type 2 diabetes check. We're going to do the A1C, fasting blood sugar test, and glucose tolerance test. Diabetes mellitus management and treatment. The management of diabetes can be done with nutrition therapy, exercise therapy, self-monitoring of blood glucose, drug therapy. We have oral agent and non-insulin injectable agents such as Carbos, Glipizide, Januvia, Metformin, Ozempic. Injectable insulin such as Humalog, Humulin R, MPH, Lantus, and so on. On this page, we have different type of insulin preparation. Please, you can take some time to look at the rapid acting, short acting, intermediate acting, and long acting insulin. Here we have some sites for if you want more education on diabetes mellitus, please follow those links. Take a few minutes to test your knowledge by taking the post test by following the link below. After you're done, you can come here and check the answer. Thank you. These are the references of my presentation. Thank you for your participation.